So I just want to start with this quote, just to give you a few seconds to read it. So this is a quote by Dr. Gail Dines. I don't know if you're familiar with her. She's a sociologist in the US. And I just love it because I think it just epitomizes a lot of things. And when you read it, you really realize, oh yeah, that's a good point. That's a really, really good point. And I think this applies to women, all women, whether you've had breast cancer or not. It applies to men, it applies to young people, it applies to everybody. So I just like to start a lot of my presentations when I talk about body image with this quote, because I think it's quite, thought-provoking. So, like Carolyn said, I am from the Centre for Appearance Research, and that is based at UWE Bristol. So I'm in the southwest. So those of you from Cheltenham, I may have met some of you before, or I've come to the centre, or I've come to the Bristol Keeping Abreast meeting in the Spire Hospital before. So we are a research centre of 25 psychologists, which sounds quite intimidating when you say that. Everyone thinks that we can read everybody's minds, which isn't always the case, I can assure you. But we are a group who are really passionate about the area of body image, and we're growing. So we're huge now. There's about 35 of us. Well, huge for a research centre university. There's 35 of us based at the centre, and the centre's been going since 1994. And we're the only centre in the whole of the world that focuses just on body image. So not to blow our horn, but we're kind of a big deal. So that's who we are. And if you're wondering what it is that we actually do, so first of all, we look at what are the nature of appearance concerns that people have. So what are they? A lot of people assume they're just related to weight, but we know that there's other concerns, and particularly across different cultures as well. So we look at what the issues actually are, and we look at who they affect. So again, people traditionally think that it's just young girls who are affected by body image concerns, but actually we know it's an issue which affects people of all different ages, different genders. It doesn't matter who you are, you can be affected by body image concerns. So we look at that as well to know who are the groups that really need support in this area. And then once we know that, we look at what we can actually do. So what can we do to support people who are experiencing body image concerns? And then the extra thing, which is why we're super geeks and we're researchers, is that we really care about finding out whether it works. So, when we develop these programs that we deliver in schools, we deliver online, we deliver in community settings to ladies such as yourself, how do we know that people leave and they actually feel better about themselves? So that is the kind of sexy research element of it that we care about. So we evaluate all the programs that we develop. So that's kind of what we do in a nutshell. And we look at all different populations. So we look at kids in schools, we look at boys, we look at older adults, we look at people who have an appearance altering condition such as cleft lip and palate, people who've had burns. We work with military veterans who may have lost limbs when they've been in combat. So we work with all different types of groups. So it never gets boring, and it's a privilege to be able to work with these groups of people. So on that note of interventions and what we do, the reason why I'm here tonight is I look terribly exhausted in this picture, which is taken from about 3 or 4 years ago, but about 8-9 years ago, I began my PhD. And my whole PhD was about what can we do for women who've had breast cancer to help them feel better about their bodies after they've had treatment. So I spent 4 years of my PhD exploring this topic, and that's when I first started getting in touch with Keeping Abreast, along with Maggie Centres, along with Haven, and all the other fantastic support groups out there. And that's me on the day that I submitted my thesis. I've had no sleep at all. But what it essentially led to is, after lots of years of work and evidence, gathering different evidence, I developed a program called Accepting Your Body After Cancer, ABC, obvious acronym. And I published a study 2 years ago now, which reported on the kind of preliminary effectiveness of this program. And some ladies from Keeping Abreast participated in this program, but it was in Bristol. So that's why it was, unfortunately, it wasn't open up for anybody else, and it was a face-to-face program. So this is kind of where this comes from. So this is a research area I'm really, really passionate about, and I really want to I'm keen to get programs out there for ladies, because I don't think there's enough. I don't think that sometimes just going to one weekly session, or doing Look Good, Feel Better once, I don't think that's necessarily going to address all the issues. So this is a 7-week program that really kind of just focuses on body image and the impacts of that. So that's where I'm coming from, just so just to contextualize for you. So the program is a 7-week session program, and it's led by a peer, so a lady who's had breast cancer herself, and a clinical psychologist. And it has discussion, activities, between session homeworks. And the important thing is that it's based on a therapeutic approach called cognitive behavioral therapy. And I'm not sure how many of you are familiar with that. That's kind of the most evidence-based therapy that the NHS uses for anxiety, depression. You know, some of you may have had CBT sessions before. And I just wanted, before I start, because you're probably thinking, why are you telling me all this? Like, just get to it. But I just want to highlight that this is something, and the advice that I provide is based on evidence. So what I found from the group is that 94% of the women found it beneficial, and they would recommend it to others. And we found statistically improvements 3 months later in body image, intimacy, self-esteem, and distress. So usually that there were no other body image interventions out there that found this among this group of women. So we're really, really happy. And if you've had a chance to read these quotes at the bottom here, again, that's just an indicator of how powerful it was for the ladies that attended. So this is where this all comes from, that I'm going to be speaking about tonight. So yeah, I just wanted to give you a brief introduction on that. So moving on. So the content I'm going to touch on a little bit tonight, but I won't have time to talk about it all, but this is just to give you an overview of what this program, the 7-week session program looks at. So we look at many different topics. So first of all, we think about aging and treatment related appearance changes. And the reason why aging is in there is because what we find is that, you know, I think we can probably all relate here that, you know, when we're getting older and we're not teenagers anymore, we're not in our 20s anymore, you know, our bodies are changing, you know, we're getting wrinkles, our hair is graying. So we're having to deal with all of that anyway. And then unfortunately, you know, you're hit with a cancer diagnosis. And then again, your appearance is being forced to change once more. And essentially you're being so kind of pushed further away from, you know, what you were when you were younger and what you see on TV, that it's really impactful. So we talk about aging changes as well, not just about treatment changes. Then we think about the sociocultural pressures. So that, when I say sociocultural, that's a fancy word for saying the impact of the media. So, you know, pressure we have from looking at social media, from reading women's health, from watching films with, you know, the desperate housewives who are meant to be in midlife, but they look like they're about 15. And also pressure from friends, from partners, and all those kind of things. Then we think about appearance within self-worth. So essentially what we try to do, and what I really care about, and with all the groups that I work with, is that I want people to be less, I want their self-esteem to be less determined by their appearance and how they feel about it. And it's encouraging people to embrace themselves and their kind of unique qualities, and if they do think about their body, appreciating their body for what it does as opposed to how it looks. And that brings me on to body acceptance and self-care. That's a huge aspect, and is really, really important in any kind of work you do with yourself for body image. You know, we look after our bodies. We need to be kind to our bodies. We need to be caring for our bodies. So that's an important aspect. And then finally, relaxation. We do a lot of relaxation in the group, and I think we all can agree that that can be beneficial. And then finally, relationships and intimacy, because that is obviously can be impacted by body image concerns, as we know. So I just want to very briefly kind of talk about what body image is, because sometimes people have a perception, or have like quite a narrow perception of what it actually is, but it's actually a very comprehensive construct. So body image is how a person thinks, feels, and behaves in relation to their body and the way that they look. And the important thing here to highlight is it's not just about how you feel about your body looks, it's about how your body, what your body does. So it's very kind of, it's very what's the word? I can't think of the word. Inclusive. It's very inclusive. It's not just about how the body looks. And the reason why this is so important is because if we can encourage people to appreciate what their body does, that can actually then have a knock-on impact on how they feel about themselves and their body image. So yeah, it's a very multidimensional construct. And importantly, we are really focused on positive body image. And that is something, so I was saying to Carolyn when we spoke last week, I was saying, you know, with all the work that we do, it doesn't matter who we're doing it with. It doesn't matter if they're young people, you know, if there's someone who has a condition. I would never expect someone to do a program and be like, I love my body, I love the way I look. I would never expect that, because sadly, you know, as we all know, unfortunately, it's very normal for people just to dislike their body. But what we do try to do is that we encourage people to experience a more positive body image. So that's kind of what I hope to get out of the work that I do in this area. And hopefully maybe I hope that there might be a slight shift in your own this evening, even though I know we haven't got lots and lots of time to go through things. So it's essentially accepting how your body looks. You might not love it, but you accept it. It's respecting and looking after your body. So, you know, nourishing it, giving it the sleep it needs, you know, being kind to it. It's seeing your body as a positive influence on your life rather than a negative one. And then finally, it's valuing diverse beauty ideals. So it's kind of filtering all these images that we see in the media that just have women who are very thin and very youthful looking and very symmetrical, and actually valuing that everybody looks different and we're all unique in that way. So that is what positive body image is. And that is what in an ideal world, I'd like everybody to experience a little bit more of. So I'm very briefly going to go over this because I'm preaching to the choir here. But why is body image so important when it comes to breast cancer? So as I'm sure we're all aware, treatment encompasses lots of different changes to appearance, but also function. And a lot of them might be temporary, but a lot of them can also be long lasting. And a lot of them can change. So, after having chemotherapy, when one's hair grows back, it could be a different color, it could be a different texture. And it's kind of that shift in identity. So it's no wonder that these changes in our bodies can have such a big impact on our body image. The psychological and social impacts can be substantial, and it's something that's important to patients. And I think it's important to note here, and I don't know if any of you can relate to this, but what we hear a lot is that patients don't feel comfortable talking about their bodies because there's this kind of thing of like, oh, I should shut up and just get on with the treatment. I'm lucky to be having treatment. This isn't important. It's deemed, it could be deemed very vain, for example, when of course it isn't. It's something that's, our body image is our identity. What we look at every day in the mirror is how we know ourselves to be. But often it is trivialized by health professionals, or health professionals don't know how to talk about it. And so rather than asking, they just avoid discussing it altogether. And then what happens is you have a patient who's obviously very unhappy but can't speak up about it, and they're not being asked about it either. So this is why it's something that's really, really important, and it's something that I care about and I want to bring to the forefront, of breast cancer care. So I'm just going to put these up here, and again, you may relate, you may be thinking, why are you telling me all this? But I think it's just quite important to reflect on all the different impacts that body image changes can have on you. And there might be things on here that you relate with more so than others. But as you can see, it has a huge impact, not only on you psychologically, but also socially, because when someone is uncomfortable with their body, they might not want to go to social outings, they might not want to go swimming, they might not want to meet a potential partner and engage in anything intimate, and it has impacts on that feelings of femininity, on one's identity, feeling let down in your body, like you can't trust your body. And I'm also aware that a lot of you might be thinking, as I'm speaking, how can you expect me to appreciate my body for what it's done? Because look what it's done to me. So, I'm also conscious of that as well. But there are huge impacts of this, and that's why it's such an important area that we should be looking at, and we should be providing more provision of support for, and also allowing people to speak out about this. So this is why it's important, and this is why I developed my program, essentially. So I just want to talk to you a little bit about the influences on body image. And you might think, oh, well, that's really obvious. You just, you feel bad about yourself, your body changes. But when you take a step back and you think about why that is, so where does this kind of pressure come from on all of us to look a certain way, to have two breasts, to have long hair? And it all relates to the biopsychosocial model. And that's kind of a fancy word for essentially saying there's stuff that's biological, there's stuff that relates to the society, impact, psychological stuff. So we know, for example, people who have a higher BMI are more dissatisfied with their body. And we also know that throughout the life cycle, so it could be puberty, it could be pregnancy, it could be menopause, all these different changes to our bodies can impact our body image as well. And then you also have the sociocultural impact. And that's what I was touching on a little bit earlier. So it's the impact of the media, and then our friends and our family, but also the stuff that we are bombarded with. And even more so, we're all on the internet more, obviously, at the moment because of COVID. But we're all bombarded with these adverts about, buy this protein shake, come do this online training with this PT. And we're basically being bombarded with, all these industries essentially selling things to us to better our bodies. So that has a huge impact on us, even if we're not conscious of it, which I think is the key thing to note as well. And then finally, you have the psychological element. So we know that people who are more unhappy or who have lower self-esteem have worse body image. But also what's really important here is that we also know that people who internalize ideals, so people who see appearance ideals and think, God, I need to be thin, I should be thin, why aren't I losing weight, for example. People who buy into that more feel worse about themselves. And then naturally, if we compare our appearances more, and we do it all, we naturally all compare ourselves, like we just do it without realizing it's human. But the more we do that, the worse we feel about ourselves, because we think, well, I haven't got what they've got. They look better. They're thinner than me. Their hair is nicer than mine, or whatever. So this is just to kind of give you the context for why we feel the way that we do about our bodies. And then importantly, other things can sadly come along the way that we didn't expect, such as a diagnosis of breast cancer. And then your body changes in 100 different ways that you never would have expected to have when you were younger, and you had no idea what was coming your way. And so if you think about all of that combined, all these different influences, it's no wonder that, people feel so dissatisfied with their bodies. So I'm going to stop talking for a second, because I'm talking a lot, and I invite you to join me with this activity. And this is very informal. I just want you to shout out so we can, I don't know, Carolyn, if you've unmuted everybody already.
Let me see if I can do it from here. Hang on just a sec. I think there might, hang on, it says mute all, so maybe it's unmute all. Hang on.
Carolyn, people have to.
Oh, say it again. Now I think I've muted everybody, have I? Yeah. All right, hold on. That was clever. I've got ahead of myself. Just a minute.
Carolyn?
Yeah.
People have to unmute themselves now. It's the new change in Zoom.
Okay, that's fine then. So if everybody can unmute themselves if they want to. But Helena, have I unmuted you, or are you fine?
I muted myself, and then I realised that I had done that.
That's fine, as long as I haven't messed it up.
Sorry for causing any confusion.
It's fine. It's all new anyway, so yeah.
We're all trying our hardest with this technology constantly changing. So if everybody can just speak out, you don't have to be polite. I'm just interested in hearing your thoughts generally. And what I would like to hear from you is the answer to this question. So if I said to you, what does the perfect woman look like today? What would you say to me?
Well proportioned.
Yeah. What else? Keep it coming, keep it coming.
Slim. Fair skin.
With hair.
To be running around with the kids.
Yeah. Very multitasking all the time. What else about their appearance? If you think about perhaps their skin, does it have hair on it? Is it no wrinkles? Yeah. What about people's faces? What are their eyebrows like? What are their lips like?
So well cared for, well groomed, yeah.
Yes, well groomed.
They probably have long legs, big boobs, flat stomach, all of that.
Yeah, all of that. So you've kind of created a list already by yourselves, but I'm just gonna get this going whilst we continue to talk, to see if there's anything else that we haven't said. But essentially, what I would like to do with this activity is just to kind of remind people that, when we think of the perfect woman, there's so many different things about them that they must have. And if you think about all these things that women are kind of required to have to be deemed attractive, they're not, but it's not biologically possible to have all these things. One can't have perky symmetrical breasts, a thigh gap, but then have curves as well. You can't have everything. And even if you are deemed the most attractive woman of the moment, like the Kardashians say, it's impossible to have all these different things. But what this is, it's not the perfect woman. It's actually called the appearance ideal of women. So what this means is an appearance ideal is what is deemed attractive by society at that moment in time. And so all those different things that we've listed just there are known as the appearance ideal. So I imagine that you'll recognize some of these people on this slide, right? So these are considered, ideals. And it's ridiculous because even then you can see that they probably had some change. So Beyonce looks quite fair, as does Priyanka Chopra. They're darker in real life. And all the airbrushing that's gone on here as well, and all the makeup. So women, particularly young women, are so used to seeing images of these ladies ideals. You can see why it makes them feel bad about themselves. So I would be interested, again, please do shout out anyone, but apart from obviously the way we've just said about the different things about their appearance, how else do you think that women are generally depicted in the media? And when I say the media, that can be, that could be films, that could be adverts, that could be anything. But how are women generally depicted?
Subservient and weaker sex.
Okay. Anything else?
Sexy.
Sexy. Yeah. Anything else?
All smooth and symmetrical.
Yeah. And if you think back to adverts, so if you think about the old Lynx adverts, you remember the Lynx adverts? Can you remember them, and can you remember how the women were portrayed in those adverts?
Just following the men blindly.
Yeah. Wearing very little clothing and all being sexualized and objectified and subservient, like you said. So yeah, generally, in addition to all the kind of appearance stuff we've just discussed, there's this kind of gender inequality, and women are objectified, which obviously we have been for years and centuries. But women continue to be depicted in this way. And then if I said to you, how are men depicted? What would you say?
Wrong, yeah.
What about men who are slightly older? So think about your George Clooney's.
Sophisticated.
Yeah.
Growing old gracefully.
Rich.
Gracefully rich. Yeah. So this
good looking.
Yeah, good looking. So this is kind of what we're talking about here, is the double standard of aging. So it's this whole thing that when you see an advert for a movie, say, you have the men and they have, their wrinkles are in place. They might have some scars. They've got graying hair. Then the women in the image have all been airbrushed and smoothed out. And this is double standard aging, that as women get older, they have to grow old gracefully. Whereas men, he's a silver fox. There's all these positive connotations that come with men aging, and there aren't that what come with women aging. And the media perpetuates that as well, so it doesn't help either. So I will ask you, I've kind of already said, but in what ways do you think media images are manipulated? So in what way do you think images that we see are changed?
Airbrushing.
Yeah. Anything else? Can you think of anything else that would go on in that process before, as that photo was taken?
Makeup, lighting, hair.
Yeah.
Style, fashion, stylized.
Yeah. And if you think of all the people who are involved, I've never been to a photo shoot, but when you see documentaries, when you see, there are so many people involved in photo shoots, and they all have a role to play at making that image look as perfect as it can. And then finally, a question I have for you is, what message do these adverts and images send to you?
That I should
They're
look
better
like
than us.
Yeah. Sorry, what was the other thing that I heard? I think two people spoke at once.
I should look like that.
Yeah, I should look like that. And why is that? What do they sell? What are they selling to us?
their bodies.
Yes.
Their bodies.
An image.
Yeah.
A perfect image, isn't it? A perfect image.
Yeah.
Happiness, self-fulfillment.
Yes, exactly. So it's not just the image, it's what comes with it. It's kind of like, well, if I look like that, I'm going to have that man, that man dreaming over me. I'm going to have this car. I'm going to have the perfect life. I'm going to be happy. So it's kind of selling this perfect look and life with it. So yeah, thank you for contributing to those questions, but I just think it's good to do a little bit of what we call, that's media literacy, just to have people think about the media that we see that has such an impact on us subconsciously. So some of you might be thinking, oh, that's not relevant to me, you know, maybe it's relevant to my daughter, but it's not relevant to me. But unfortunately, because it's just something we grow up and we're given a Barbie doll to play with. You know, we're made to watch Disney films where all the princesses have eyes that are bigger than their necks and their legs, you know. It's something that we grow into, that we're just born into, that we don't even realize. But all this stuff has an impact on us from a very, very, very young age, whether we like it or not, because we're bombarded with it. We're told from day one that we should look this certain way. So I just think it's good to get people thinking about that. So here's just some kind of examples, and I think this just highlights a lot of what we just discussed. So if you kind of look at, it's quite interesting because you look at the people who are deemed to be kind of in middle age or to be a bit older, and they still all look very idealistic. So if you look at Jamie Lee Curtis in this advert here for Good Housekeeping, you know, she still hasn't barely got a wrinkle on her, and she's very, very thin. And similarly, if you look at the advert of Twiggy, I mean, Twiggy hasn't got a wrinkle in sight, you know? And then it also makes me laugh because this one in the middle here, so you have this advert for fighting 15 signs of aging. But I don't know about you, but that girl looks like a teenager to me. You know, who wouldn't be even considering anti-aging formula. And I think what I'm trying to highlight with these adverts is that if you see these, you're bombarded with these every single day, you know, and this one over here, which is horribly, completely sexualizing women, you know, the messages that we are sent as women, and particularly, and it doesn't matter how old you are, is that, you know, we should look younger. You know, we are objects. We should be trying to lose weight after we've had our baby, you know, and so these are the messages that we experience every single day without even realizing. And that's why it has a huge impact on us, because we don't look like these images, you know, because it just isn't realistic. So now I'm going to move on to a video just to kind of demonstrate. So we spoke earlier, obviously, about the airbrushing and all the different things that go on. And I just wanted to share this video with you to kind of highlight the extent of airbrushing that goes on, because I think sometimes people guess, they say, oh, well, you know, it gets rid of the lines, it makes them thinner. But I don't think they necessarily realize the true extent of all the different changes that happen to that image. So let me know if this doesn't work. Let's hope that it does. Okay, so I'm just going to pause it there, but I'm really intrigued to hear what your thoughts were after seeing that video. Anybody?
That's quite outrageous, actually.
Yeah, were you shocked at the kind of the extent of things that they were doing?
Yeah, so much. It's so wrong, isn't it? Yeah. Really wrong.
There wasn't anything they didn't change, was there?
No.
No.
But girls can do this on Facebook themselves, can't they?
Yes, they can. So
can they?
Selfie. Yeah, you take a selfie. They can actually change the image to what they want the selfie to look like, and that's frightening.
Yeah, and that's a conversation for another day, or later on we can discuss it. But yeah, you can see why we're very busy with our work, because unfortunately the social media is the biggest source of pressure for young people, and because they do have these tools at home to airbrush themselves, you know, young people, and I'm sure if any of you have kids, you might have seen this yourself, you know, they won't post they won't post an image that's perfect.
Totally, yeah.
So yes, and then obviously you might look at the picture and go, that's not my daughter, she looks completely different. So it's quite shocking. This was something that was kind of, controlled by the powers above, by the businesses, by the industries, whereas now this is something that we can all do. But what it does is perpetuate appearance pressures and perpetuates body dissatisfaction, because we're all, we should change our images, we're not good enough, essentially. So that's just something I wanted to share with you. And if you're interested, if you want to share it with anyone, any kids or anything, if you go to Body Evolution, there's so many different videos out there. I wish that we could spend the whole evening looking at these videos because they're really, really shocking. I encourage you to share them with other people as well. So I just kind of want to highlight this cycle, which is what we've kind of discussed, but just to kind of really lay it out there for us to see it. So these media messages are so powerful. Media messages that we get from brand industries are powerful because we see these images, so we see the adverts, and when we think about what we look like and what they look like, there's a big gap between them. And so we then feel bad about ourselves and we feel that we're not good enough. And so we buy the product because we hope that it'll fix our body. Just like, all of us might feel pressure to, and this is complete, and there's nothing wrong with this, but there's a reason why we draw on eyebrows. There's a reason why we might put fake eyelashes on, because there's this expectation that, we should do that. But you buy these things to kind of fix yourself. And you hope that you'll look like that image and that you'll kind of have this ideal life like we discussed before. But then what you realize is that when you use it, that doesn't happen. You're exactly the same. You haven't experienced this change in your body or in your life. And then you pick another thing that you don't like about yourself. And then what do? You buy another product. So if you think about this, the way that it is very, very clever. All these industries are essentially just making money out of us. That's what they do. They want to put insecurities into consumers so that consumers will buy their products. And it's quite sick when you think about it in that way. But they're using our vulnerabilities. They're exploiting us for monetary gain. And so this is why the media is very, very powerful, very powerful. So I just want to move on to, because I'm just conscious of time and I want there to be enough time at the end for us to have a discussion or answer questions. But I'm just going to quite a bit now, something else, onto self-care. So self-care is, as I said, it's a really important part of looking after ourselves, but also helping us appreciate our bodies. And I think what's really important to highlight, particularly to a lot of you as well, who I imagine do have families around you, you are multitasking a lot of different roles, is that it is not selfish to care for yourself. It's not selfish to make time for yourself, even though it might feel difficult because, you feel like you have to be with the kids, look after the kids, be the care provider. Self-care is really, really important, and you should make time for yourself without feeling guilty. It's important to prioritize your own needs because you can't pour from an empty cup. If you are burnt out and if you aren't cared for, how can you care for other people? And it's really important to kind of give yourself permission to pursue, your own interests. What is it that you're interested? What are your hobbies? What are your desires? And I really love this image on the right-hand side, which my friend actually sent to me, which is why I've used it here, when I was a bit stressed about something, and she just sent me this, and I was like, yeah, it's a good point. It is important. I need to get rest. I need to get light. I need to get water and other things. Really, really great. I think a lot of women, particularly in midlife, who have lots of responsibilities, struggle to make time for themselves. So I just want to introduce you to the Healthy Mind Platter. I don't know if any of you are familiar with it, but it was essentially conceptualized as these 7 key activities that we should engage in to kind of have a healthy mind, but also to contribute to well-being. And I really like them because it encourages us to reflect on different parts and what we are and aren't doing so much of. So the first one is sleep time. And obviously we all know that sleep is really important. We all need sleep. But it's also important for your body because it recuperates your body. It heals, any wounds you might have. It consolidates all your memories from that day. It's really, really important for self-care. And obviously physical time, physical activity, any type of physical activity. And we're going to talk a little bit about that later. But that's really good for the body as well. And then focus time, which is essentially when you're doing a task which has a goal in sight. So that could be you working, doing a job, or it could be you doing a crossword, but it's something where there's a goal and you really kind of have to concentrate, because we all know that's good for our minds as well. And then connecting time is really important, and not only connecting with people around us, which I know is quite hard at the moment because of, you know, what's been going on, but also connecting with nature. So going outside, connecting with the world around you, which I think a lot of us have had the opportunity to do a bit more. And, you know, I think when we had that one, you know, the 1 hour a day, I think not just me, we were all kind of out in the park enjoying connecting with the nature around us. And then playtime, so doing something spontaneous or creative or kind of like on a whim, something funny, something fun is really important as well. And then downtime, which is literally doing nothing. So that could be sitting and watching a trashy TV series and drinking a glass of wine, eating some chocolates, you know, not using your mind at all. And then finally, time in. And when we talk about time in this aspect, it's about time inside your body. So tuning into your body. How does your body feel? You know, engaging with your different senses, but also reflecting on your emotions, your thinking, how you're feeling. So these 7 things, it's, you know, it's recommended that we have a balance of all those different things. And it might be that we spend more time in one than the others, and, you know, and we don't spend so much in the other in other ones. But I think it's something good to reflect on about what could we be doing more of in each one. So oh, I missed out oh no, here it is, sorry. So I thought it might be nice just to have a really brief chat about this. And I know this is quite a hard, like I was saying, it can be quite hard for women to reflect on this because they're very used to being the caregivers. But I wonder if there are any things in particular that any of you feel that perhaps you could be doing a bit more self-care, so you could be spending a bit more time just kind of being with yourself or looking after yourself or doing something for you.
Silence.
You know? Or maybe you're all practicing lots of self-care and that's fine, but do any of you kind of recognize that perhaps maybe you're not kind of prioritizing yourself or giving yourself, you know, looking after yourself as much as you might be, as you should be?
I think it'd be easier to answer if we weren't on lockdown with children not at school, if I'm honest. I used to be really good at it.
No, I completely agree. It's not a good time to answer. And also, this is the kind of thing that I think you can't just have a discussion about this in 5 minutes. Like, and it's something that kind of evolves and you have to go away and think about. So I won't, you know, we don't have to talk about it. And there's more, you know, I've got other things to go through. But what I would encourage you to do, I'd invite you to do, is maybe have a think about what 2 self-care activities could you plan for yourself this week. And it could be something as simple as getting up a little bit earlier than everyone else in the house and having a coffee in the garden if the weather's, well, I don't know about what it is where you are, but it's not great here. Or it could be having a bath. It could be one night saying to your husband, your partner, you know, saying, I just want to have an hour to myself in the bath, read a book, have a cup of tea. Or it could be meeting up with a friend, going for a walk, a distance walk, just something that is for you and is not for anyone else. So I encourage you just to have a little think about what that could be, and reflect on the mind platter and the different areas we spoke about, and have a think about what you could do for yourself, because it will have a knock-on impact on how you feel about your body and what your body allows you to do. You know, when you apply nice moisturizer to yourself after you've had like a shower or a bath, like that's looking after your body, but that's also engaging your senses. It's smelling the nice cream, it's kind of touching the texture of it. You know, so really think about how you could use your body, even in kind of mundane stuff, like when you're washing up. You know, you do that every day without thinking, but maybe next time think, oh, you know, what does this smell like? What does it feel like? What does it sound like, the water trickling out of the tap? So I know this might sound a bit lame, but actually when you really, really start to engage with your body with these simple things, and you think about what your body allows you to experience, it gives you a different way of looking at it. And it encourages this kind of appreciation of your body in a different way. So yeah, I encourage you to do that, to engage your senses and plan something nice for yourself. So I'm going to move on because I'm very conscious of time. So my last couple of slides, I'm really sorry that I haven't had, you know, this isn't something that you can do overnight. Fortunately, it's something that you do need time, you know, and ideally I'd be seeing you every single week and we would be exploring these more. And there may be the opportunity to do that. I'll talk about that at the end. But I just wanted to kind of give you some nice hints and tips that you could start doing today, you know, right here and now, that you can maybe try and commit to a little bit. So first of all, as I said, appearance comparisons are really, really common. We all do it. You know, you might find that you compare yourself with yourself pre-cancer perhaps as well. You know, we all compare ourselves with ourselves, our friends, you know, celebrities that we see. It's only natural. But I think it can be really good to try and catch yourself. So when you feel yourself doing it, when that little voice in your head is looking at that person and is telling you and criticizing yourself, saying, oh, you don't look, you're not that, you don't look that good, you know, she looks really feminine, whatever, catch yourself doing it, because it's something that we do so automatically, but it's literally just like knocking away us feel bad about ourselves. And I think a really key thing here, I don't know how many of you use social media, but we do know from this time that there's more and more people using social media because they're at home. And thinking about what you follow on social media. So maybe think critically, are you following some people or pages that are making you feel bad about yourself? How could you change up what you see? You know, could you look at more body positive content, perhaps? Could you look at more humorous posts? Could you look at something completely different? So for me, I love plants and I like kind of like DIY interior design. So my Instagram is like full of plant related things and, you know, DIY stuff. So really think about diversifying your kind of social media landscape so that you're not pulled into comparing yourself with other people. Or if you're brave, have a complete detox. You know, don't go on Instagram or Facebook maybe for like a week and just see how you feel. See how you feel, if you feel any differently. See if you miss it or see if you feel better. Because we all, and I'm not just saying about appearance, we all compare our lives with other people. You think, oh, well, they're on this holiday, or they've had a kid, they've got an amazing house or whatever. We all do it. But yeah, unfortunately, social media is a baddie when it comes to body image. Next, which this relates to self-care, is about practicing self-compassion. So I think particularly now, because it's been a really, really tricky time for everybody, but I know particularly for yourselves, you know, treatment's been delayed. You know, for you guys, it's been particularly hard. And I think whilst it's difficult to do this, I think practicing self-compassion, self-kindness is really critical right now, really critical. And it might not come naturally, which is why you should think about what would you say to your friend? If your friend, you know, says something critical of themselves, or, you know, was just fed up and was like, oh, I can't do this, or God, I hate how I look, I hate this, you know, what would you say to them? So I think reflecting on that, because we're all very good at talking the talk to other people, but we're harder on ourselves. You know, we're not very good at being self-compassionate. So speak kindly to yourself, you know, like really do try and, when painful feelings come up or emotions, try and be kind to yourself. Because it's really, really important. And also recognize that everybody has different experiences, but everyone feels pain. Everyone can have similar feelings to you at some point. It's completely normal. It's part of the human experience. But, you know, it's really important that we're kind to ourselves. You know, because the one person you're going to be with the whole of your life is yourself at the end. I know that sounds cheesy, but it's true. Like, you're the person you're going to be with throughout the whole of your life. So, you know, look after yourself, be kind to yourself. And then this again goes back to this appreciation. So for your body, like, rather than thinking about your body as an instrument, as an ornament, think of it as an instrument. So rather than focusing on what it looks like, and I'm not saying this is easy, I know that for a lot of you, you know, your appearance has probably changed drastically. But if you focus on what your body can do for you, what it allows you to do, and that could be, you know, healing a wound, that could be healing. So after you've had your surgeries, healing your scars. It could be anything like that. It could be going for a walk with your friends, playing football with your son or your grandkids. It could be anything, but just think about how amazing our bodies are. And yes, I know sometimes they can't be kind to us. And I know that a lot of you may feel very let down by your bodies. And that's why this is a difficult thing to do, but there is some good in our bodies as well. So I think trying to think about the functionality of it is really, really helpful, because, you know, they are incredible what they do for us and the healing they give us as well. And then last but not least, and then I will shut up, and I'd love to just kind of hear your thoughts, questions, is thinking about physical activity. And this comes back to the whole thing about bodies changing. So a lot of you might feel, you know, more tired these days. A lot of you might kind of be like, oh my God, like, am I meant to feel this way? Is this age? Is this kind of, you know, left from the treatment? And I think it can be really hard when your capabilities change. So if you're someone who is really into sport or running or cycling, whatever it may have been, and you feel like your body isn't allowing you to do that anymore, it's really important to adjust your expectations. And again, this comes to self-compassion and trying to not compare yourself, you know, with yourself before other people. adjust your expectations and thinking about physical activity in terms of not something that you do to, you know, oh, well, I ate lots of cake, I should go and lose weight, or whatever it is. Think about it as doing as an activity, something that you enjoy, something that kind of helps you engage your senses, connect with people around you, with the world around you, connect with your body. So focusing on it in that way, I think, is a lot more powerful than kind of focusing on exercise and thinking, oh, I can't do this anymore, and oh, I need to lose weight, I wish I could do this exercise and lose weight, because that's not helpful for anyone. And we also know from the literature, from research, that people who do exercise because they care about their body and because they kind of want to look after themselves actually have better body image than people who do it because they want to lose weight, and people who do it because they want to improve how they look. So actually, it's better to kind of use your body in an empowering way, and whatever it may be. And that's why I love these adverts. Some of you might be familiar with This Girl Can. I love their campaigns. I think they're so inclusive and empowering to women. But I think they hit the nail on the head. You know, it's caring for your body. It's doing it because you're enjoying the physical activity. It's not because of any other pressure you're putting on yourself. And with that, I will end and stop talking, because I've spoken for quite a while now. And yeah, it would be great to kind of hear some thoughts if anyone has any questions.